Not all psychosis is the same. Some psychosis comes from the mind, some psychosis comes from the brain. Let me explain. So today we are going to look at the difference between functional and organic psychosis. But we have to first know, what is psychosis? So if you are still new to this channel, please subscribe and watch until the end.
What do you know about psychosis?
Psychosis is a mental problem, but I want to maybe simplify it for our viewers to understand.
Please simplify psychosis.
Yeah. Psychosis is a mental condition which is characterized by three things. One of them is someone has hallucinations, okay? Someone has disorganized behavior, and what? Delusion. Okay? So any mental disorder which is characterized by hallucinations, there is delusions and disorganized behavior, it is called a psychosis.
So you've talked of hallucinations, delusions, disorganized what? These are big terms for our viewers. What is hallucination?
Okay, like when we talk about hallucinations, we have the five senses, okay? We have the eyes, okay, which is the sight. We have the nostrils, okay, for smelling, okay? We have the tongue for tasting. We also have the ears, okay, that is for hearing. Then also we have the senses of feeling, okay? So hallucinations can always come in these five areas, okay? Like this is perception without external stimulus. Like you be here, you are seeing a lion, but other people around are not seeing what?
The lion.
A lion. So that is called a visual hallucination. Okay? You are here hearing voices, but other people are not what? Able to hearing those voices. So that is called auditory what? Hallucination. Okay? So hallucinations come in a different areas. It can be like the ones which move, like you find some patients are moving like insects are moving on their bodies. Those are called tactile hallucination.
Tactile hallucinations.
Like you find a patient is moving like insects, maggots are moving on all over the skin, and is trying to remove them, and for you are not able to see them. So that is called tactile hallucinations. And this hallucination happen in different mental disorders, and they help us when we are managing the patients. For example, someone of epilepsy, they may have a strange taste or smell. Okay. Yeah, there are some of these hallucinations which are like if someone is having commanding voices of people. Say you go and kill yourself, you go and kill so and so, you move around from this one. So those are auditory hallucinations, but they are commanding in what? In nature. Okay, so those are hallucinations.
Okay.
Yeah. Then on disorganized behavior, I think the behavior we may understand it very well. Like our actions, how we do things. You find it, when people are mentally sick, they do things in an abnormal way. You find someone is talking so much, is restless, is doing things that you are abnormal in our community. That's a disorganized what? Behavior.
Okay.
Okay. Then
delusions?
Yeah, delusions are false beliefs. I know when you are watching us, there are some times where you can have shared delusions. Okay? Delusions are false beliefs which are held by a patient, and you cannot change them by mere argument. Okay? Example, like someone says, I'm the president of the whole world. So someone says, I'm the president of the whole world. So it's, you are not the president. You can argue from today, tomorrow, but the person
still remains
says, I'm the president of Uganda, I'm the president of Kenya, I'm the president of USA.
Yesterday I was conversing with Trump.
Yesterday I was conversing with what? With Trump. So that is a false belief. Okay?
Yeah.
And we have also different types, but for this one, I want you to know that there can be shared delusion.
Shared delusion.
There's also where you find that like you share the delusion with the patient. Like you believe what the patient is what?
What the patient is thinking.
Yes, like in the we have like someone in the church say, I have spiritual powers, I can heal.
Yes.
You find yourself also following, okay, let us go, this man has powers to heal. Then you find also you are believing that. That is called a shared what? Delusion.
Shared delusion.
Yeah, but we have different types of delusions. Maybe I will come and tell you, but we have what we call grandiose. Grandiose is where someone talks good about themselves, like says, I'm the president of America, president of Uganda, and the person feels very nice. But there are also those ones which you call persecutory, whereby someone says people are against him, people want to kill him. Those are persecutory hallucinations. There are these delusions where someone feels like his body is projected in upwards. He's seeing his body in space.
Wow.
Then another one can be there that I don't have a heart. He's walking, but there's no heart. Okay?
Delusions, okay.
Yes.
So hallucinations, delusions, disorganized behavior.
Yes.
Those are the three things that are seen in psychosis.
Yes.
Students who are watching us right now, the terms we use like organic psychosis, functional psychosis. Can you please tell us the difference?
Okay. So such terms, some of them we could call them outdated. When we talk about organic psychosis, we are talking about psychosis where there is evidence of brain damage. Like when we carry out physical findings, then also we do laboratory tests, may suggest we find that maybe there is brain damage. Okay, like we do a CT scan, it can show us that there is what? Brain damage. Okay, we can look at the CT scan, we do other laboratory tests, maybe even from the history, they tell us that this person maybe got a head injury when they was traveling back home, he got an accident, and when you do a CT scan, you find there is what? Brain damage. Okay? On the other hand, there is what we are calling functional psychosis, is that when you carry out history taking, and also you do the test or the laboratory test, there is no evidence of what? Of brain damage. But the brain has been affected in the way of functioning. Like the reasoning, the judgment, the way of perceiving things has been what?
Has been changed.
So that is what always what is called functional what? Psychosis.
Okay.
Yes.
So functional psychosis, no evidence of brain damage.
Yes.
Organic psychosis, there is evidence of brain damage.
Yes.
Okay. Now, what are some of the conditions that present with psychosis?
Okay. There are so many conditions which present with psychosis, and occurs like when we talk about let's say functional psychosis, we are talking about the brain has been affected in the way of functioning. We have other conditions like schizophrenia. We have bipolar affective disorder. Okay. We have also we can have schizoaffective, like have symptoms of schizophrenia. And also 6 symptoms of what? Of mood. Okay. Even depression itself, we call it major depressive disorder. It can come when someone is having psychotic what? Psychotic features. So those ones, when you do a test, you carry out your brain CT scans, or even you do history, there is no physical findings that will show that there is evidence of what? Of brain damage.
Okay.
Yeah. Then also on the other side, like if we talk about organic, like we said, evidence of brain damage, like someone has been drinking a lot of alcohol, that is any evidence. And you find maybe has got what we call encephalopathy, maybe is talking things that are uncoordinated, or we call it substance-induced what? Psychosis. Okay? There's this other sicknesses like HIV. HIV can go up to the brain and affects the brain. So you find someone seeing things that you don't see, doing other things, so you find it is HIV-induced psychosis. Okay, we can have these people with diabetes, people with hypertension, causing them high psychosis. Like someone has increased sugar levels, and that one causes them to have what? Psychosis. So those are what we are calling organic. There is evidence of brain what?
Of brain damage.
Brain damage. But we have most of the conditions psychosis, and that's where we get the name Antipsychotics. The medicine that I used to treat psychosis are called what?
Antipsychotics.
Antipsychotics.
Okay. If you're watching us, please subscribe and comment. If you have any questions, put in the comment sections right now so that we are motivated to create more content for you. So tell us some medicines that we can use to treat psychosis.
Okay. So psychosis, of course, as I've told you, there are medicines that I used to treat psychosis, and we call them psychotics. Like they do the opposite of what? They to stop those symptoms of psychosis. So they gave them a name, antipsychotics.
They reverse.
Yeah, or sometimes they are called neuroreptics.
Neuroreptics.
Yes. And if someone has not, if you are out there and you have not watched our video, I talked about antipsychotics. I talked about the different types. We have different types of antipsychotics. There's what we call first generation antipsychotics, where we have chlorpromazine, we have Haldol, we have sterazine, we have Haldol injection. Okay. Then also we have second generation antipsychotics. Okay. Also we have like olanzapine, risperidone. So these are some of the medicine that are used to managing what? Psychosis. Okay. So if you have your doctor, someone suffering from psychosis, the doctor can prescribe one of them depending on their condition.
Right. Thank you very much. Thank you very much for sharing with us, and thank you for watching also. And please remember to subscribe to our channel, comment, and if you have any questions, just leave in the comment sections there. Thank you.